Thank you for staying with us right here on Good Morning Namibia. Now, earlier on, we took a look at an insert produced by our very own John Ekonja, where he engaged Dr. Melody Chapero on cancer awareness as well as the importance of early detection. Now, as we continue in the tangent of health care as well as health-centered conversations, palliative care and cancer awareness remain critical components of Namibia's healthcare system, especially at community level. Now, on the 13th of November 2025, Hope Home-Based Healthcare officially launched its palliative care implementation program alongside cancer awareness and testing in Tsumeb, a major step towards improving the quality of life for patients and families facing life-limiting illnesses. To help us understand the significance of this initiative, its impact, and what it means for the community, we are now joined in studio by Egleen Wieses. Good morning and welcome to the show, Ms. Wieses.
Good morning, Ms. Jemima. Thank you very, very much for having me again. And thank you for the wonderful and very, very impactful partnership with the Namibian Broadcasting Corporation.
Well, thank you for the work that you've been doing. But Ms. Wieses, last year in November, the Hope Home-Based Healthcare launched its palliative care implementation program alongside cancer awareness and testing in Tsumeb. For our viewers watching at home, could you help us understand what the main purpose of this launch is, especially for those that may not be familiar with what palliative care means?
Thank you very, very much for the opportunity. Palliative care is simply, it is a very, very important integral part of healthcare services, which still needs to fully be implemented in our country. Palliative care simply is a service that provides a patient or individual-centered care. And this needs to take place, as I have said before, at the point of diagnosis of specifically or more with serious life-threatening illnesses like the cancers, the strokes, the stuff that really quickly take persons out of life. Once it is implemented or provided at the point of diagnosis, it helps the treatment outcomes, or it improves the treatment outcomes and the quality of life of the person, of the patient. It improves the quality of life of the family that is also affected, the family, the friends, the society. It really, palliative care, normally a human being takes long to adapt to things, especially new things. But I would say palliative care, only the term is new. In Africa, we support each other generally. But the term palliative care and what goes around with it, the personalized care, that needs implementation. And this is a very important aspect of the well-being of our patients.
When it comes to palliative care, it is often misunderstood when heard in social settings or conversations as end-of-life care. Why do you think that misconception comes about when you've just explained it as care that ought to start at the beginning of diagnosis of any life-threatening disease?
I think it is just the accepting change, accepting new things. That is actually the problem. The end-of-life care is equally important, and it is integrated into the palliative setting because we speak of palliative and hospice care. And these things need to go together.
And what is the difference between the two?
The palliative care is to improve life quality. That will add life to the patient, where end of life is preparing the patient for exit. End of life is when the prognosis, for instance, says the person has 1 month to go, 2 months to go, 3 months to go. When the clinical staff releases the patient into we've done everything that medicals could do. Now it's time to ensure taking care of the patient. That's the real palliative care situation, where the doctors would not do anything anymore, but the palliative, the service that we provide would now take it from that step and ensure that the patient receives every single thing, a holistic care, the medication, the follow-up, the physiotherapist, the biokinetics, every single thing would continue as though the patient would still be fine.
Yes.
Because it is important for the patient. We need to relieve pain and suffering. We need to provide emotional support. We need to reduce stress, because all these things goes along with stress. It gives a patient anxiety, it gives them depression, and all these little things are adding to the reduction of life.
Yes.
But once the patient has all this care in place, it improves the quality.
Absolutely.
Because you take away the worry, you take away the anxiety, all these things adds to the reduced vital life of the patient.
Yes, but there's still quite a number of points that I would like to touch on in the interest of time. But this, we understand that this initiative was launched in collaboration with the Ministry of Health and Social Services. Why is this partnership so particularly important, particularly for community-level health care in places like Tsumeb and surrounding areas?
If you look at Tsumeb, we do not have any specialist in Tsumeb. We do not have the intermediate hospitals like in Windhoek and Oshakati. Now, through what we are doing, we are closing the gap between the healthcare, the district hospital, and the challenges, the accessibility. We're on the ground. We see and we experience and we know what's happening. So we are closing that gap between the ministry, the district hospital of the Ministry of Health, and the community, and the district, and at large in Oshikoto region. Now, the partnership, the importance of the partnership is, it is recognizing our work, it is enhancing the services that we are delivering, because we were kind of a standalone, but now being recognized and integrated by the ministry means we will have more persons to provide our care to.
Now, you've mentioned that you are on the ground when it comes to engaging with patients, with members of the community, and really bridging that gap. From what you've seen so far, how has the community reacted and received the services that you provide in the form of palliative care and cancer awareness activities?
Well, the community, one should say, they are very appreciative. They've seen the quality, they've seen how it improved lives, they've seen how broad our support is. So the community is very supportive and they collaborate with us. One would say this because neighbors, friends, family, they are all reaching out to us. This is because they've recognized that what we are doing is somehow supportive and assisting. Yes. We've been very, very active. Currently, for the past 5 to 6 months, as narrated by the Right Honorable Prime Minister Ngurare in Tsumeb on the 13th, we're going through a very terrible financial situation that the ministry is currently busy solving. Yes. But it has affected our service delivery negatively, but we have not deterred. We continue, we push on. We do with our hands and with our mobility what we can to still contain and continue to provide the services. With regard to the cancer, as the earlier insight by Dr. Melody, yes. Currently in Namibia, we are faced with the cancer. I am kind of scared that it could become a pandemic, but we now need to do our work with the awareness and testing on the ground so that the ministry can see where we are. But we are dealing with a lot of cancer cases currently. And the biggest sad part is that almost 60% of the patients we are dealing with are diagnosed at a very late. It's detected very, very late, which is disabling the ministry to really effectively combat for this disease currently.
Thank you so much, Ms. Gwises, for taking the time to talk to us about this very important and very pertinent matter, and that is affecting so many of our members of our communities across the country.
Well, thank you very, very much for having us, and we should thank NBC for the smart and strategic partnership, because NBC is helping us to take the message out. And we would not on the ground be able to cover as many people, or we would not be able to access as many people as possible. But because of NBC's partnership, we are able to have this kind of platforms. We will have radio interviews so that we can maximize the education and awareness about cancer, similar to it is the enemy. It is the enemy kind of. We need to push this through so people can get aware and step out of the fear to know the diagnosis, because it is only upon diagnosis that you can receive medical care.
That's
and
right.
if it is detected early, you can successfully be treated.
That's right.
And this is very important.
That's right. Thank you so much, Ms. Gwises.
Welcome. Thank you very, very much, Ms. Jemima.
All right.
Have a lovely day.
You too. That was Ms. Egleen Gwises talking to us about the launch of Hope Home-Based Healthcare's Palliative Care Implementation Program and Cancer Awareness and Testing Initiative in Tsumeb, what it means for families, for patients, as well as the broader community in Tsumeb.